Everyone knows a couple people in their lives that are hypochondriacs, and those hypochondriacs always are in the hospital. They're always in the doctor's office. They're always sick. There's always something going on. The germaphobes, oh my gosh, I don't want to touch this. I don't want to touch that. This person has a cold. Stay away from me. Those are the people that are always sick. It's like you hang out in the hospitals, you're going to be sick.
I mean, there are some studies that say up to 50% of medical interventions are mostly placebo-driven. Like, if you believe something's going to help you, it's probably going to help you. On the other side is the nocebo, and a lot of people don't know about that. Things can actually harm you if you believe they're going to harm you.
Here's another good example. A lot of people, as soon as someone's sick around them, or maybe they got a family member that's sick at home, they think, oh my God, I'm getting sick. And then they have that mindset, I'm getting sick, and then all of a sudden they get sick. And then they're sick for a few days, and the second they start to feel better, they're like, oh, I'm recovering. Then all of a sudden they recover. I always think about like how much the mindset plays a role in that.
The mind is a super powerful thing. I think people don't appreciate how much it plays into your overall health and wellness.
All right, guys, welcome to another episode of The Report. Today, I'm very excited because I got someone special. I got an orthopedic physical therapist who's also an author, and someone who's got over 2 million subs and followers across a couple different platforms online, including YouTube and Instagram. I got my man, Dr. Tom Walters. Dr. Tom, welcome to the show.
Thanks, brother. Thanks for having me. Excited to be here.
Yeah, appreciate you, man. Dude, I got so much to dive into. But first question for you, man. What is the biggest misconception that you see in the orthopedic physical therapy space?
Man, that's a good question. There's so many misconceptions out there. I mean, this is a lot of the reason I got started on social media back, dude, like end of 2016 is when I got started. I think probably the thing that one of the biggest misconceptions out there is that people often put too much weight on their posture. Like they think too much about their posture when it comes to like having pain, like thinking, a lot of times people are thinking like, oh, if I'm in this posture, my shoulders are rounded, or I've got one leg that's longer than the other, it's going to mess me up for life. I'm doomed. I've got this problem. And there's just, that stuff just more and more in the research isn't really supported. We, humans are just like asymmetrical beings. It's, very rarely do you find someone who's like really perfectly symmetrical. I mean, even if you look at the research, about 95% of people have one leg that's longer than the other. But if you go see a practitioner, a lot of them will say like, ooh, you've got a problem. Your leg, this leg's longer than the other. That's going to mess you up. You've got to, do these exercises, or you got to come see me, or you got to put something in your shoe. There's just a lot of stuff out there.
So you're saying posture does not, because for me, I've been curious. I've had lower back pain, maybe like a handful of times in my life, and typically due to an injury. Weightlifting, or my posture was wrong when I was doing like a deadlift or something like that. Now, I'm always sitting and I'm, doing random stuff, and I don't get back pain, right? Unless I injure myself. So, and I put myself in weird situations. So what really causes back pain? Is it the posture? Is it what is it in your estimation?
Dude, back pain is a complex one. We look at all pain now from this biopsychosocial model. And so you have to look at like, back pain is super complex in terms of it can be, you have some people who have back pain that's mostly triggered by depression. Like they have depression or anxiety, and it's more of a mental health issue that triggers their back pain. Some people, it could be more mechanical, like you're talking about, like where they go do a heavy deadlift and they strain their low back, or maybe they have a disc bulge or disc herniation that causes their pain. There's a bunch of factors. Spine pain in particular is often more complex than others. You were talking about the posture, right? You brought up some good things there. I'm never trying to tell people that posture doesn't matter at all. It's just that for a long time, even when I was a new physical therapist, like I've been a PT for 17 years, in the beginning, I would tell people, this is good posture and this is bad posture. Like you got to stand up, military posture, shoulders pulled back, chin tucked in. And what we found over time is that really the problem, there's not really a good or a bad posture. The problem is if somebody's in one posture for too long, like we're just too sedentary. And so really more of the message now is you just got to keep moving. Like I'd have people who would stand and sit with perfect posture, and they would be the people with pain. So you'd think if perfect posture was the answer, those people should never have pain. And then you'd meet people who are slouching and they felt great. So, when it comes to weightlifting, like if you're talking about posture where it's just your body weight, that we tend to not worry about what position you're in anymore unless it's causing you pain. But if it comes to like weightlifting or like sports, where if you're like a soccer player and you're running down the field and you're cutting across the field, when there's a bunch of force on your system, then your like biomechanics and your alignment and your posture matter more. That's why like you'd never take somebody who's brand new to the gym you'd never take them into deadlift and have them do it like with super heavy weight with their back rounded. Like it wouldn't be, it'd be a recipe for an injury. So it matters in those situations.
Yeah. So like I notice when I sleep, I'm a side sleeper. So if I sleep on one side too long, I'll just switch over to the other side, and that discomfort momentarily, it like goes away when I switch over. And it's not like, I wouldn't say it's painful, but it's just like I could tell my body needs to adjust. And then boom, I'm like, okay, this is comfortable again. And so you're saying it's fine to be in weird postures, but you just need to move around a little bit.
That's it. That's what it's all about. Your nervous system is really good at telling you when you need to move out of something. So it's the people who are in a position and it's painful and they maybe can't move. Maybe it's like a work situation where they have to be seated all day, or they have to commute. You get people who have pain sitting in their car. They can't get out of that position. They're just in traffic. So if you just listen to the message and you can change position, that's what it's all about. Sleep is another great one, because you'll see social media stuff that's like, don't ever sleep in this position. It's horrible for your back or horrible for your neck. It's all BS. Like, you just have to find that's comfortable for you. And if something becomes uncomfortable, your nervous system's going to let you know and you're going to move, and it's not that big a deal.
Mm-hmm. Yeah, that's interesting, man. So a lot of people say that like popping your fingers. I know as a kid, I used to always pop my fingers. I don't do it so much anymore, but every now and then I do, just to, it feels like sometimes the air gets a little tight and it feels good just kind of pop them a little bit. But ever since I was a kid, the teachers would always say, don't pop your fingers. It's not good for you. It's going to cause you arthritis and all these issues as you get older. Is that true?
Yeah, no, it's been debunked. A lot of people ask me this question and are worried about that. They're like, oh, I've heard that if I pop my joints, it's going to cause arthritis. And it really has been debunked. There's actually kind of a cool study of this guy. He went and had imaging done, like x-rays and MRIs on his hands. And for like, I think it might have been 50 years, he won a big award. He popped all the knuckles on one hand and not the other. And then he redid that imaging at the end, and there was no difference. So it was kind of cool. I mean, it's just one person. It's not like it's a study with hundreds of subjects. But, I will often tell people when they're worried about popping their joints, they have to think, like, if you go see a chiropractor and they pop your back, they are popping your joints as a treatment. Like, so that thing you're worried about doing, like when you have your back popped, like an adjustment, your spinal joints are about the size of your knuckles. So it's a very similar thing. Like if you pop the knuckles in your hand, that's similar to someone popping the joints in your low back. And again, somebody's doing that to you as a treatment to help you. So they probably wouldn't do that if that was going to cause arthritis or, injure your joints in some way. It's just a pressure release.
What causes the popping sound?
Yeah, it's called a cavitation. What they talk about now is it literally is just a pressure release in the joint. So, and it will last. There will be a temporary period where you can't get that joint to pop again. So it's like 15 to 30 minutes. And it can help people temporarily. A lot of people, when they've had a joint manipulation done, or even if they do it themselves, they'll feel kind of a temporary release in tension, pain. You'll even get a little bit, you'll even see people get a little bit more mobility for a little while, but it tends to be a temporary thing. It's like something, if you're in that business, it's good for business because you can have people keep coming back for that technique, but it's not a good long-term strategy.
Yeah, I mean, I'll do a little cracking like here and there with my fingers every now and then, the knuckles, and then a little bit on my back, but it's like, I don't think about it, right? I probably do it maybe like a couple times throughout the day. And it's just like when I feel like a little bit tight, and then boom, and it feels good. But I do know some people that are just always popping.
Yeah, I think it gets to be like a sort of anxious habit for some people. I did that in high school for like
a nervous twitch.
Like a twitch like that. Like,
yeah.
Like you say, you don't even really think about it. I think a lot of people are doing that all the time. They're not thinking about it. I mean, I'm like you nowadays. Like if something feels tight, my back feels tight, I'll twist it and it'll pop. And that's totally fine to do. You're not, it's really just a stretch. And sometimes you stretch and the joint pressure releases in the joint. And so it's no big deal, but a lot of people worry about it.
So total myth. Don't listen to what the teachers say when you're in elementary school, middle school. You can crack your knuckles, pop your back as much as you want, and it's not going to affect your long-term health at all.
Exactly. You can, exactly. Crack away.
Okay. I like that. So what about knee cracks and all this sort of stuff? Because, I think some people, when they walk around, sometimes even myself included, sometimes if I walk around, I might feel pop or hear a little pop like with my knee or something like that. There's no pain, zero pain, but it might happen every now and then. And I do hear some folks complain about, hey, their knees are always popping, especially as they get older. What is your take on that? What exactly is happening?
Yeah, it's kind of similar actually to like popping your knuckles and things like that. the research on our joints, like our musculoskeletal system, it's just very normal for it to make noise. Like it might be like the joint kind of popping. Like a lot of times people squat down, their knees will pop. Mine do it all the time. They've been doing it since high school. And it just, in that case, is another pressure release in the joint. Sometimes people will have like noises from tendons kind of shifting around. They'll feel like they'll move their shoulder and they'll feel this little clunk or something like that. So I tell people, if you don't have pain and you haven't had a recent traumatic injury, then don't worry about your body making noises. Like if the noise hurts, then that's worth looking into. Or like if you've had a recent like traumatic sports injury or a car accident and now you've got new noises, those are worth paying attention to. But in the vast majority of cases, noises from the body are completely normal. There's actually been some research showing that in the knees, a knee joint that's healthy and lubricated actually pops more than one that isn't.
Really? Why is
So
that?
it just has to do with like the synovial fluid in the joint and just, that joint being healthier allows it to build up that pressure differently than a joint that's unhealthy or maybe has arthritis. So, but people worry about this, and people are often embarrassed about noises. There was even a study that looked at this with knee popping. People, if it happened in a social situation, they were really embarrassed about it. And if you ever have your joints pop around other people, sometimes people will be like, "Ooh, are you okay?" So people who don't know about this area, that will make them worry even more like, "Oh, do I actually have a problem?" And I think the message here is your body, it's very normal for your body to make noise. If you don't have pain and you haven't had a recent traumatic injury, don't stress about those noises.
Yeah, that's good to hear, man. That's good to hear. Yeah, it's interesting because I think there's a lot of people that just kind of walk around every day and they get used to certain things that are maybe going on in their body. But I was playing pickleball a year ago, and I don't play a whole lot. So it was a year ago. I probably play like twice a year. But fun fact, my little niece, her name's Courtney. She's like semi-pro pickleball player. Her fiance, who's been on this show, he's like top 10, top 15 ranked pickleball player, but they're always playing. So when I go visit the family every now and then, I'll get out there with a paddle and we'll go play. But I remember this specifically, it was like holidays last year. I think it was like Thanksgiving, and we were out there on the court. And there was a bunch of pickleball courts up there in San Clemente, which is where I'm from. And it's one of those sports where like people can be like older and like just go out there and rip you.
Yeah.
Like I've got my ass kicked by old ladies. Like it's
Same.
pretty cool. Yeah. Anyways, we were playing with this older lady. She was like in her 70s, and she was like, "Yeah, I'm playing on a torn ACL," and she was out there ripping it and just kicking my ass. And I was like, "Dude, this is crazy." So, anyways, how can someone tear their ACL and still be out there like playing pickleball, especially an older lady? Like, tell me about that.
Yeah, it's actually kind of cool with ACL. So your ACL is a ligament in your knee. It's one of your 4 big primary ligaments that basically holds your knee together. Like your femur is your thigh bone, your tibia is kind of your shin bone, your ACL is one of the 4 ligaments that holds those 2 bones together. What's interesting is there are certain people who tear their ACL, we call them copers.
What does that mean?
It means that they're able to use their neuromuscular system to stabilize their joint, even in the absence of like with that ligament being torn. So you even see some Olympians like this that have torn ACLs, but they're so good in terms of their muscle strength and their ability to coordinate their muscles. Because your muscles and your nervous system, your joints are stabilized by 3 things. We call it like the passives, your passive stabilizers, which are ligaments. You don't have any control over those. Like you can't tell your brain to squeeze your ACL. Like it's just, you don't have voluntary control over it. You have your muscles and you have your nerves. You kind of have those 3 things: ligaments, muscles, nerves. If you tear a ligament, you're really just at that point relying on your muscles and nerves, your neuromuscular system. So there's some people, these Coper kind of individuals, who can stabilize their joint just by gaining muscle strength and improving the coordination of their muscles. There are other people that we try it with. Like a lot of times we'll try this in rehab. Like maybe they go through 8 weeks of rehab and we'll see. And they still can't stabilize their joint. So those are the people that go have a surgical reconstruction.
Got it. Okay. So some people can do a good job of kind of like training their body to compensate for it, and they're fine. And maybe depending on sport, right? Some sports are a little bit like football as a running back, or, you're reacting and every little split second matters.
Totally.
And the stop and go stuff is probably rough.
Yeah.
If you don't have an ACL, right? But
for sure. Yeah.
Pickleball is maybe a little bit easier.
Yeah. Like stuff where it's like, stuff that's high force or change of direction is going to be way harder. I was just talking to a surgeon about this the other day, and he said, even in people who can use their muscles to control their joint and maybe decide not to have surgery, some of those people can develop arthritis sooner because they can have little, like, you imagine like your femur and your tibia are coming together. There can be little movements in there that you can't detect where those bones are kind of rubbing against each other and damaging the cartilage. And if you had the ACL, that wouldn't happen. So there is some research looking at people developing arthritis sooner if they don't have their ACL fixed.
Interesting.
So it's just kind of it's a tough decision, right? Because if you have surgery, you're guaranteed out for probably 9 months to a year before you return to like full, like if you return to sport before 9 months, they've shown in the research, like if you're an athlete and you return to sport before 9 months, your risk of having a second tear is so much higher. Like just you have to wait that long for that graft and that new ligament to heal.
Got it.
So it's tricky. Like a lot of people are tempted to just go the non-surgical route, see if they can just stabilize with their muscles, which, I mean, like I said, I've seen Olympians who do that.
Does that ligament grow back and recover on its own if you go the non-surgical route?
That's what's crazy too. They're finding it does in some people. Like this is kind of new research and they don't really know. I was just talking to someone about this the other day, someone whose whole career is just researching ACL kind of injuries. And I was asking them about this and they said, yeah, some people, they'll do MRIs, they don't have surgery, and they do another MRI like, maybe 3 to 6 months later and see evidence of the ACL going back and healing again, but they don't really know like who that happens in. Like it's so early now in the research that we don't really know like why that happens and who it happens with.
Yeah. Interesting, man. And that's probably why you see some football players, especially quarterbacks, I see, like, especially if they're making a late season run, playoff run, they're like, hey, I'm just going to play with a torn ACL. Okay. That makes sense. You
exactly.
throw a brace on there and they can kind of get through.
Yeah, put a brace on, strengthen, yeah.
Yeah, interesting, man. So a lot of people sprain their ankles, right? I think it's one of the most common injuries out there, if I'm not mistaken. I used to play basketball and I used to skateboard. So I used to sprain my ankles all the time. Well, I would roll them all the time. And they would swell up. I remember throwing my feet into like ice buckets to get the swelling down. But I remember rolling my ankles so bad sometimes to where they would swell up to the size of like softballs and it'd just be all purple and black, like disgusting. And I go to physical therapy and that sort of thing, but you kind of get used to it over time. And so now when I see like NBA players like LeBron James and Kobe Bryant when he was playing, they roll their ankles like, because you see the replay, I'm like, oh my gosh. And then I don't know how they do it, but they just play through it. I'm like, fuck, that's crazy.
Yeah.
So talk a little bit about what exactly is a sprained ankle?
Yeah, ankle sprains, like you said, I mean, dude, they're the most common injury. If you look at the stats, it's like 15,000 a day in the US. I mean, there's so many of them, and they usually are the one you're talking about. There's different types. The one that's most common is an inversion sprain where your foot rolls in. So your foot kind of rolls under. It happens a lot in basketball.
You're talking about the other way.
No, like you were saying,
outside,
like
yeah.
the outside of your foot rolls down
that's
under.
the most common.
Exactly. It hurts the ligaments on the outside of your ankle. That happens a lot in basketball it happened to me the first time in basketball because I landed on somebody's foot.
Yeah.
And it just makes
the most common way.
Dude. So, and the same thing like you, I swelled up like crazy, and I've luckily only had one really bad one, but basically with, that's the most common sprain, that inversion sprain. It damages, you have 4 big ligaments on the outside of your ankle, and it can either stretch or tear those. And what'll usually happen is people will have swelling. If it's really bad, they might get black and blue kind of up into their foot and up their leg, but you're basically stretching those ligaments out. And like we were talking about the ACL, your ligaments connect bones together. So if you stretch a ligament out, you lose joint stability. So people who have had one ankle sprain are usually way more likely to have another one, because if you really stretch those ligaments, it's just easier to turn your foot back in that direction again because the ligaments aren't stabilizing you as well.
Sure.
But it's kind of, actually, it's very similar in a way to the ACL rehab. In rehab, you're looking at basically improving the person's strength and coordination and balance. You're trying to train their neuromuscular system to make up for that loss of integrity in their ligament so that they can learn to stabilize their ankle and essentially make it less likely that they sprain again.
Yeah.
But dude, yeah, you look at some of those videos, like I watch some of those basketball videos, you watch them in slow motion, their foot like rolls all the way over and it's like their like lower leg bones touch the floor. And then they're back playing. It's crazy.
Yeah, I don't know how they do it. Now, what about when it goes the other direction?
Yeah. That's an eversion sprain. So if you imagine like the inside of your foot kind of rolling under, those don't happen quite as often. You have the ligament on the inside of your ankle is even stronger. It's called the deltoid ligament. But you do see it sometimes in like football where someone's foot will get is planted and it's like their leg kind of turns out and they roll over that direction, but their foot is stuck like while they're getting tackled. And you'll see really bad eversion sprains like that. It can even go up higher and damage. Up higher, you have your 2 bones, your tibia and your fibula hooked together. Sometimes it can tear that, and that's called a syndesmosis injury. I mean, those can be pretty brutal, but you don't see them as often.
Mm-hmm. What are some ways to rehab a sprained ankle that work well?
Yeah, a lot of it is just simple like balance training stuff in the beginning. Like you could just start standing on a solid, like a cement floor, wood floor, just eyes open, work, see if you can hold that for a minute without touching the other side. Try and do it with your eyes closed. We rely a lot on vision for our balance, so trying to do that eyes closed. We'll have people do, if people have sprained their ankle, they'll see exercises like where you take resistance bands and you basically hook it on your foot and you strengthen each direction. You've got these muscles on either side of your ankle. On the outside, you have your peroneal muscles. On the inside, you have a muscle called posterior tibialis. Those are sort of like your built-in ankle brace. So strengthening those muscles can help to hold your ankle in that neutral position. Things like calf raises are really good, like just simple. Nobody does calf raises, dude, but calf raises, besides like not having chicken legs, like, they're really good. Calf raises are really good just for, like, kinda prehab, just keeping your ankle healthy.
Yeah, I feel like a lot of people neglect the calf raises. When I do leg day, I try to incorporate. I typically do it at the end, and I literally just do like 3 sets, maybe 4, and that's it. But you probably should train them more than that, right?
Yeah, I think, I'm the same as you, like, I feel like I'm only doing if I'm being honest, I'm probably just doing my calves once a week, which probably is enough just to kinda maintain them, but they're probably not really growing. But, yeah, I think if you're getting a lot of the research now on muscle hypertrophy, it seems to be, like, if you can get, like, 10 sets a week for a muscle group, that will help it grow.
10 sets.
Yeah.
And so ideally, you train these muscle groups twice a week.
I would say, yeah, I would say, like, if you can get, like, 3 to 5 sets, twice a week, something like that, that's probably the best for not only helping them grow and get stronger, but also calf raises are gonna protect your Achilles tendon, and we know, like, talk about, like, people rupturing their Achilles tendon. I'm 42 right now, and dude, I've had so many buddies recently rupture their Achilles tendon. It's like this is probably the thing I worry about the most when I do sports now.
Kobe Bryant ruptured his Achilles tendon back in 2000. I want to say 2011, 2012, and he was out for like a year and a half. Really, he didn't really come back. And I mean, a lot of people say that kind of ended his career. That was the start of the downfall of his career. And when that happened, he was at the top of his game. I think that season he was dropping like 28 points a game, and he was playing high minutes later in his career, and he tore the Achilles. He was never the same after that. So what exactly is happening when you tear your Achilles tendon?
Yeah, so your Achilles tendon, it hooks your 2 calf muscles. You have these muscles, gastrocnemius and soleus. They're your 2 calf muscles. Those muscles hook into your Achilles tendon, and then it hooks on your heel bone. And essentially what happens in most people, usually what happens is the person's putting their leg back, like they're pushing their leg back to push off and change directions. And when they do that, it stretches your ankle into what's called dorsiflexion. It's kind of like think about if you kind of pulled your toes up towards your nose, it's the opposite of pointing your foot. So when you pull up in a dorsiflexion, it stretches your calf muscles and your tendon. And so when people are reaching back, if you imagine like a basketball player reaches back with their foot to push off and change directions, you get this big stretch on the tendon, and then you're also putting a bunch of force through it to push off and propel the other direction, and then it just pops off the bone. So it can tear from the bone, it can tear in kind of the middle part of the tendon, but yeah, essentially, like, your calf muscles are no longer attached to anything anymore.
Yeah, that's crazy. And so the recovery time with that is extensive, right? We're talking
Dude, it's at least
12
a year.
months.
It's another year. Yeah, it's like ACL kinda in that way. Those 2, man, like I say, I don't worry so much about ACL now at my age. Like, my girls wanna ski, and sometimes I didn't grow up skiing, so that kinda freaks me out sometimes, but those are the 2 that I probably worry the most about just because it's like you're looking at a year recovery. And I've even had patients where at a year, they still can't do a calf raise. Like, I mean,
That's crazy.
So you can imagine, like, Kobe's situation, somebody who's really high level like that, you have an injury like that, you can imagine where it would be kind of the beginning of the end in terms of your performance.
Well, I mean, to be out for that long and not get those reps in, and then at the more of a later end of your career, age wise, to not be able to get the reps in, the at bats, and at that level, it's like you're no one ever maintains. It's like you're growing or you're dying, and yeah, I think that was the start at the end, unfortunately. But I'm always amazed by these guys in the NBA, like especially like LeBron James. These guys, I'm like, even Kobe when he's playing, is like, how do they play through game after game after game at that level? And they're always, I'm sure they're playing through all these minor injuries that they don't even talk about, and these aches and pains. And so for them to do it at that level for that many years, it's like, I'm just impressed, man.
Yeah, it's pretty crazy. Like, their durability and just kind of the resilience of their system is pretty impressive. And I know LeBron takes it really seriously and, spends a lot of money just on, like, rehab, prehab, like, just taking care of his body, which is impressive. I'm sure Kobe was the same way. Another thing with the Achilles tendon that a lot of these injuries happen when people are getting older and they don't really train their Achilles anymore. So like the calf raises are a good start, but even something just like jump roping, like your Achilles tendon is a spring. So you need to train it like a spring, and just doing, even if you don't have a jump rope, sometimes I'll just do these, we call them pogo hops, where you just basically do single leg hops. You just keep your knee relatively straight and just hop. And that really can help keep your Achilles tendon healthy.
I didn't know that you could strength train your Achilles tendon.
Yeah. Yeah, your tendons get stronger when you strength train, just like your muscles.
Oh,
Yeah.
interesting. Okay.
So they'll get thicker, a
they
lot
grow.
of, yeah, your
Really?
tendons grow too.
I didn't know that.
Yeah.
Okay.
Yeah.
I thought you were just born with whatever tendons you have.
Oh yeah, no, it's crazy. It's crazy how many of the tissues in your body will actually adapt with something like strength training. Like you look at studies on weightlifters, like their tendons are thicker, their ligaments, their bones are denser. Of course, their muscles are bigger. Even the discs in their spine change and get kind of tougher.
So you mentioned doing calf raises will actually strengthen your Achilles tendon.
Mm-hmm. Yeah. Those are kind of the main things. Like when we look at,
because you're stretching, right? When you go down on the calf raise, you're stretching it.
Yep.
And then you go up, and then you're strengthening it.
For sure.
Okay.
You strengthen on the way down too.
Okay.
People don't
negatives.
always. Yeah, that's the eccentric contraction. So whenever you do a weightlifting exercise, anytime you pick something up, right, there's a phase of it. Like if you imagine doing a bicep curl, on the way up, your bicep is shortening and contracting. That's called a concentric contraction. On the way down, your bicep is still contracting. It's just the fibers are getting longer. That's called an eccentric contraction. Same for a calf raise. The way up is concentric. The way down is eccentric.
How important is that, like on the way down where you feel the stretch in the muscle and the tendon? How important is that stretch in terms of the growth of the muscle?
Oh, it's huge. Like it's huge. In weightlifting, it's the thing that most exercise scientists will talk about now as being one of the most important factors for muscle growth. Like you've got to, I was just thinking this morning, I went and lifted before I came here.
Did you? Me too, man.
Yeah.
We should have got a lifting together.
I was doing.
Where did you go?
I was just at the hotel gym.
Dude, I wish I would have known. I would have invited you to the compound this morning. It is the best gym in Southern California. People drive down from LA on the weekends to get a lift here, day pass. And dude, it's great. It's massive. It's got all the best equipment in the world. I'm not a fitness influencer by any means, but all the fitness influencers of San Diego work out there, and the trainers and all that sort of thing. And these guys are telling me, hey, some of these machines in here are like 1 of 7 in the world, right? And it's just great, man. People are in there, like people are really in shape. And so some people go in there, they're a little bit intimidated, but once you get used to it, I'm like, I love it because, I'm by no means the most in shape person in there, but you got to get yourself in rooms to where people inspire you, right? I talk about that with entrepreneurship and business and money. Like you're a sum of the 5 people you hang out with, you know what I mean? Same thing with the gym and the fitness. So I go into this gym, everyone's in really good shape, and it forces me to level up. But I wish I would have known you were in town, man. I would have invited you out.
I don't know much about San Diego. It's crazy. I went to school, physical therapy school in Orange County at Chapman, and a bunch of my buddies from my class live down here, but I just don't get down here very often. I've never even heard of that gym, but it would have been way better than my hotel gym. But I was doing front raises in there, like deltoid raises, and I started doing them with dumbbells, and then I thought the same thing you were just talking about. I was like, on the bottom of this dumbbell raise, I'm not getting any stress into the lengthened position for that muscle. And so I went over to the cable machine. So I think people, if you're trying to maximize like growth of your muscle strength, tendon strength, you need to think about, is the weight being applied all the way through that full movement, especially into the lengthened position? Like if you imagine a squat. Squats are, if you're doing like a barbell back squat, at the bottom of that, if you go down, that's why going deep is helpful, because when you go down to the bottom, your glutes and your quads really stretch. So you get all that growth in your glutes and quads. So on that deltoid raise, I went over to the cable machine and I started with my arm across my body and then raised out. And the nice thing about that cable machine is it pulls your arm across your body and it really lengthens your deltoid fibers. But that's a huge thing. Nobody's really asked me about that, but normally we think about strengthening and going into a position where the muscle fibers are lengthened for muscle growth and kind of performance. But I think it also is an aspect to consider for rehab.
What do you mean when you say for rehab?
Just because it's going to maximize strength, and like when you're thinking about when somebody's coming back from an injury, usually the strength training comes at the end of their rehab program. Like in the beginning, you're working on getting pain under control. You're working on getting their mobility back to normal. But then as that stuff gets better, then most physical therapy and rehab programs really should be focused on strength training. Because if you imagine like your musculoskeletal system is it's very mechanical. And so like if you make your muscles and tendons stronger, they're less likely to be injured and tear in the future. They have that like mechanical nature. So strength training is such a huge part of rehab and physical therapy.
Yeah, I can imagine. So like hamstrings, for example, doing straight leg deadlifts, right?
Yeah.
You go down, you really feel that pull. I guess my question for you is, if you're doing the straight leg deadlifts, are you building more muscle and strength training, or strengthening them further by doing heavier weight and less pull, or lighter weight and more pull and really feeling that stretch? What's more
Yeah,
important?
that's a good
Because
question.
both make you really sore.
For sure.
Yeah.
Yeah, because I think there's a lot of people actually that they don't have a great mind-muscle connection, and sometimes they'll put a lot of weight on the bar, and then they end up putting probably a lot of that stress into their low back and into their spinal extensors, the muscles on your low back. I know this happens to me sometimes. If I put too much weight on, I'll kind of stop feeling my hamstrings, and I'll feel like I'm just trying to create the movement with my low back. So I think there's a sweet spot, like, of, maybe the thing that's important for people to think about first is start light and really dial in that mind-muscle connection. Like, really be intentional when you're lifting. Don't be like talking and being distracted. Like, really think about, can I feel this muscle contracting? Like, as I lower the barbell, I feel my hamstrings lengthening. I'm squeezing them and thinking about it. And then I'm really squeezing them as I come back up to bring the bar back up. Like, get that mind-muscle connection dialed in with lighter weight, and then try to carry that over. Because at the end of the day, the best situation is going to be you've got good mind-muscle connection and heavier load to where you're essentially getting to failure. The exercise science research has kind of changed recently. It used to be like, I don't know if you heard these numbers, but it was always like, for strength training, you did like heavy weight, low reps. Hypertrophy was a little bit higher reps, like the bodybuilders were like 8 to 12. And then anything above 12 was more of like muscle endurance. And now they're kind of changing it to where it's like, just go to failure. Like, even if you have a lighter weight and maybe you can go to 20 reps, as long as you go to the point where those last couple reps, like, you almost can't complete them, you will get muscle growth.
So that's the most important thing. Go to failure.
Yep.
Okay. Interesting. So let me ask you this then. Is it better for muscle growth to do 20 reps before you hit failure, or 6 to 8 reps before you hit failure?
I think if you look at the research, I think people would still say heavier load, get to failure earlier on. Like, some of the strength athletes they might do, you think about like a max session, they might only do 1 to 3 reps, so I think, and it could be a little different if you're talking about pure strength versus muscle hypertrophy, like getting your muscles bigger. But I think really probably a good spot for most people is
8 to 12.
Yeah.
Yeah.
That's what I do most of the time.
Okay.
I mean, I'm like, I never gain much.
Because that's kind of been my theory, and that's what a lot of these fitness trainers and influencers that I work out with. It's funny because I'm at the compound, and everyone's in such good shape, and I'm like, people come up to me all the time, and they're like, oh, like, I listen to your podcast or whatever, like, love to get a lift in, and kind of pick your brain a little bit about investing and that sort of thing, real estate. And I'm always like, yeah, let's do it, because these folks, like, I'm learning these cool workouts that they're teaching me. So it's kind of a value exchange. And I always tell people, like, hey, if you want to connect, like, come to the gym with me, because, like, I'm going to be there anyways. And we can talk while we work out. And it's the best way for me to, like, connect with someone, because now I'm not spending additional time that my schedule is very limited, and time is very valuable. But it's like, I know I'm going to be at the gym anyways. It's kind of an accountability partner. If I'm like, hey, I'm going to meet you here at 6 a.m. on a Wednesday, cool. It's a reason for me to get going, and then we can talk shop. I'm always happy to talk shop, but it's like we're kind of killing 2 birds with 1 stone. One of my favorite sayings is spend time with people who are intentional about how they spend time, right? And so, people that want to just connect and grab lunch and just, bullshit. It's like, I don't have time to bullshit. Life is already short enough as it is, right?
No,
So
I feel exactly the same way. I don't do many of these meetups for just like coffee and lunch anymore. I'm like, I want to be getting something else done. And like, your exercise session is such a great way to do that. Like, lifting with someone, you could sit there and chat while they're doing their set, you're doing your set. It's a perfect way. Do you hear 8 to 12 reps a lot with people?
So anyways, yeah, that's what I was saying.
Yeah.
I digressed. So these folks that I'm training with, they said 8 to 10 is where you should be kind of working yourself to, what do you call it? Exhaustion?
Yeah, to failure.
To failure. Yeah,
Yep.
8 to 10.
Yep.
And they say once you can do more than 12 before failure, then you need to go up in weight. And then maybe the next step up in weight, you can get to 8, and then work yourself up at 12.
That's a pretty common like strategy from back in the day with the old research. I think maybe the nice thing for people to know is, like, if you can't do a super heavy weight for some reason, it's okay to like have something that's a little lighter. Just go till you can't do anymore. Like, that's the key, I think, for a lot of this, is just the last couple reps should be like you need a spotter or you got to set the weight down. You can't complete it.
Mhm.
So
Yeah, that makes sense. Question for you. So a lot of people out there trying to get in shape, and they go to these spin classes, they go start running, they do heavy cardio. See people out there doing like canoeing, all sorts of different stuff. But a lot of it is very heavy cardio based and not much strength training. And then on the flip side, you got a lot of folks out there that are heavy in the gym, doing a lot of strength training, very minimal cardio. I'm one of those people. I stopped running 5 years ago. I skateboarded as a kid, played basketball as a kid. I put a lot of wear and tear on my body as a kid. I see these 55-year-old runners that have been running their whole lives. They're limping around. They don't have much muscle, lean muscle, muscle mass, if you would, and they're just limping around. And I'm like, dude, I don't want to look like that when I'm 55. And so 5 years ago, I made the decision to stop running. And now I just lift heavy weights. I walk. I do some hiking, all low impact stuff. And I got to say, man, at age 39, my body has never felt stronger. It's never felt healthier. How important is it to lift heavy weights?
it's so important. It's literally the thing I probably talk about most of the time with patients. Again, like people are coming to see me. It's not right away when they come to physical therapy, but it's the end stage you're looking to get to is just helping people understand the value of resistance training, like strength training. Like a lot of times we'll call it resistance training, but it's essentially like going to the gym, lifting weights. It could be bands. Sometimes it can be body weight. Like if you do enough reps of push-ups, and you can do a lot of things with manipulating your body weight to make it really challenging, but strength training is incredibly important in your health across your lifespan. I mean, a lot of people have probably heard these different studies, but actually grip strength and your quad strength are highly tied to mortality, like when you're going to die. So if you lose grip strength or you lose quad strength, it's kind of an indication. It's not just losing those alone means that you're going to die, but if you're losing strength in those muscle groups, it's an indication that you're probably weak across other muscle groups. And so your quads, for instance, like I used to work in nursing homes. A lot of times people in nursing homes, they can't get up out of a chair by themselves. And that's largely quadriceps and glute strength. So if you lose quadriceps strength, for instance, you lose the ability to function independently. And if you become sedentary and you can't get out of a chair, you're just more likely to get pneumonia, get these other things that end up killing you. So strength training has all of these huge things. We know that muscle mass declines as you age. So strength training will help to offset that. Bone density tends to decline, especially in females as you age. You hit a maximum point. Your bone density maxes out around age 30. So from there, it's just a slow decline. So you can offset that with strength training. Strength training, and this has been kind of a newer area, but strength training, you used to always hear with bone density, like you need to do body weight, like impact exercise. Like, so people always just like thought walking and running. But there's been newer studies showing that strength training, like really strong muscular contractions with heavy weight, release these molecules into your bloodstream called myokines that actually one of their effects is to make your bone stronger. So strength training is huge. Cardio is important, but I think a lot of the cardio research now, because we do know that your VO2 max, like the maximum amount of oxygen that you can use in your body is the number one predictor of mortality. Strength training is kind of just right underneath that. Like your strength is right underneath that. But with mortality, a lot of it is like zone 2 cardio, which you could go walking, you could go hiking. A lot of people are into rucking right now. Like
What's that?
Rucking is like where
What's rucking?
it's like a heavy backpack and you just walk around with it. So if walking by itself, like where I live, there's kind of some hills, and walking is it gets my heart rate up a little, but it'd probably be way better if I put on like a 30-pound pack and walked around with that. So rucking has become super popular right now, and it's a great way to get zone 2 cardio, but also not to have the impact on your joints that like running would.
Yeah, that makes sense. Or maybe swimming as well.
Swimming, yep. Yeah, cycling, like all of those are great in terms of lower impact, but also getting that cardiovascular kind of level to keep your heart and lungs healthy. The only downside with swimming is that if it's your only sport and you do it every day of the week, tons and tons of time swimming, you actually can reduce your bone density because there's no stress on your system. So if you're a swimmer, if you're somebody who does a lot of cardio, I think the message here is like 2 to 3 days a week, do strength training. Like you need strength training.
Yeah, that makes sense. And you mentioned grip strength has a lot to do with longevity and at what age someone's going to pass away. Tell me about that. What does that mean when you say that?
Yeah, so grip strength, so basically they take these dynamometers, they're grip dynamometers. I don't know if you've ever seen one, but you can squeeze it and it will tell you how many pounds of force you can generate. And usually people will be stronger in their dominant hand than their non-dominant. But what they've found is when people really drop in their ability to generate force with their grip, that's associated with dying earlier. So it's kind of like the quad strength. An easy test actually that was studied, this one doesn't have to do with grip strength, but if you can go from standing down to the floor and back up without using your hands, that actually is also a predictor of how long you'll live. And a lot of that
like a squat?
Yeah. Well, all the way down to sitting, like all the way down sitting on your butt with your legs crossed.
Like in a chair like you are right now?
On the floor.
Oh, on the floor.
You've got to go from standing to the floor.
Without using your hands at all?
Without using hands. Now, if you touch
I don't even know if I can do that right now, man.
It's actually pretty challenging. You
right?
could get it. You could get it.
Oscar, can you do that? Try to do it. Oscar's going to try to do it right now. Let's check this out. He's over here in the studio floor right now. And Oscar's 24 years old, in shape. Okay.
Okay, and then can you get back up?
Okay, now can you get back up?
There you go. You can.
See?
Yep, there you go. Yes.
Oh.
There you go.
Now he had to tuck though.
Yeah.
Now what if you don't tuck that foot in?
It's okay to tuck.
Oh,
if you touch a knee or a hand, you lose 1 point, and it's out of 11 points.
Okay.
So for every point you lose, they tracked people after they did this test. They were more likely to die earlier the more points they lost.
Okay. So now if you tuck a foot, you don't lose a point.
No, you can.
All right, Oscar, you got 11 out of 11. Let's go, baby. Just the beginning.
You can do it. You can do it, Rich. If you just a lot of it's like the strategy of figuring out. But people who are really weak, there's no way, even if you teach them how to do it, they can't get up from the ground. Like my mother-in-law is 80. There's no way she could do that without putting her hand on a coffee table or something. She's going to probably lose her balance a little bit.
I know 40-year-old men that couldn't do it.
Yeah. Well, you think about how many people are overweight right now. You think about that extra weight on their system, and then they don't strength train regularly. Like you put these factors together. People don't think about it when they're in their 40s or whatever, late 30s, 40s, 50s. They don't really think about this stuff. They don't think about it catching up to them. But you start getting into your 60s and 70s, this stuff really matters.
Yeah, absolutely. Yeah, it's interesting stuff, man. So it's definitely, I think it stresses the importance for anyone listening to the show. It's like, if you're not lifting heavy weights right now, you should probably get into it. It's something that you should probably carry into your later years.
And it doesn't have to be complicated. Like go hook up with a trainer that you like and trust and listens to you. Like it doesn't have to be, you can keep it simple. Like it can just be simple patterns, like a squat pattern, a lunge pattern, a hinge pattern, like a deadlift, a pushing pattern, like a bench press or a chest press, pulling patterns like rows and pull-ups. Like you don't need that many. Like if you had 5 to 6 exercises that you did it heavy and you went to failure and you did that 3 times a week, that could be a 30-minute session if you're efficient.
Oh, easily. Yeah, I agree. Even 20 minutes, if you did it multiple times a week, would be enough to probably maintain at least, right?
Exactly.
And then in addition to that, when you lift heavy weights, you build muscle. It makes it easier for your metabolism to burn fat.
Yep.
Talk a little bit about that.
Yeah. Yeah, muscle is really metabolically active. So most of the calories we burn during the day are when we're at rest. It's called our NEAT. It's non-exercise activity thermogenesis.
What does that mean?
It just means the calories you burn when you're not exercising.
Okay.
So if like I've got a Garmin watch and I look at my calories burned each day, if I go for a run and a lift, I might burn 500 calories. But the rest of my calories, say I'm burning 2,500, 3,000 a day, the rest are non-exercise calories. They're just my body running. And so when you have more muscle mass, you just naturally, because muscle is really metabolically active, you're going to burn more calories just at rest. This is why so many of the people who are specialists in body transformation and fat loss prioritize strength training. Cardio will burn calories while you're doing it, but that pretty much stops when the cardio session is over. Whereas strength training, they'll say you're burning more calories for 24 to 48 hours after. Like your body, when you go to the gym and lift and you get really sore, you've caused little microscopic tears in those muscles. Your body has to repair those muscles, and that takes energy, which takes calories.
Yeah. And that's why I say I think it's one of the biggest misconceptions around getting in shape, fat burn, is, hey, I'm going to go do spin classes. I'm going to do all this heavy cardio. And I hear it all the time. I hear it. I'm sure you see it. And it makes sense because if you look at these people that just do nothing but spin classes and run, they have no muscle and their bodies just look frail. And I'm like, dude, I don't want to look like that. But so I think the strength training kills 2 birds with one stone. One, you're working on your physique. And that's huge. The way you fit in clothes, your posture gives you confidence, right? And at the same token, it's allowing you to burn a lot more fat at rest versus the cardio path where you're only burning fat while you're in it and doing the exercise. So for me, if we got to pick one or the other, we're all busy folks, right? We only have so much time in the day. And, I'm not a professional athlete. I'm not getting paid to train, right? But if I got 1 hour or maybe 2 hours a day, I'm gonna strength train. And if I got a little more time in the day, I'll probably do a nice 4-mile walk or go on a little hike. And for me, that's good enough.
Dude, and the other thing I didn't mention is that weight training, if you do it the right way, can have a major cardiovascular benefit. You know what I mean? Like, you might not need the running and walking. Like, if you do like a circuit style where like you're doing supersets and you just keep moving from one exercise to the next, your heart rate will be up.
When I'm hitting leg day, man, I can barely breathe.
Exactly.
Yeah.
Yep. So people don't always consider that side of it. Like, if you're doing like a bodybuilding program where you're doing like 2 to 3 minute, 5-minute rests in between sets, yeah, your heart rate's not going to be up. But like, if you, a lot of times I'll be in there and I'll be like, maybe I'm doing barbell bench press, and then in between my barbell bench press sets, I'll do single leg squats. So it's just my body weight, but it's really keeping my heart rate up, and then I'll go back to bench press
That's
again.
like the what do they call it? I want to say Bavarian, but it's not.
Oh.
What, the single leg squats, the split squats, Bulgarian split squats.
Bulgarians.
Is that what you're talking about?
Yeah,
Because those things are great.
Dude, Bulgarians are one of my favorite. They destroy you, but they're so good.
Yeah, destroy you, but they work on balance, and then you really get that deep squat on each leg. Oh my gosh.
And
those
they're
are the
good for
best.
people with back pain, because sometimes people with back pain, if they do a barbell back squat, or front squat, it will hurt their back. Whereas if you're in a split, like in a Bulgarian where your legs are split apart, it actually kind of keeps your spine in neutral. So for people with back pain, and you don't need as much weight because you're kind of just, more of the load is on just one leg.
Yeah. I usually start my leg day with the Bulgarians. I'll do a little stretching, and then I'll jump into the Bulgarians, and it just like it sets the tone for the rest of the leg workouts, and like the blood's already flowing. Now, if you do them on the end, like a little burnout, those can fuck you up too.
Oh
man.
yeah, dude, you're like,
So
you can't
good,
even
though.
walk out of there.
Yeah.
There are days like some of those days, like the next few, I won't even be able to, like, I'm trying to just get up from, I can barely stand up. Like, I'm so sore from them, but
It's the best though. It's
Oh,
good sore.
It's good. Like, I think sometimes people who aren't used to exercise, they don't frame it that way, but I agree with you. Like, when I'm sore, I feel like it's positive to me. Like, I'm going to rebuild and be stronger.
You feel like you're making progress. Now, what you said though, for the folks that don't work out and they get in the gym for the first time in 3 years, and then they work themselves to exhaustion, and their muscles are not used to that movement, and haven't done it in 3 years, and then they get this crazy sore that lasts an entire week. I get it. That's discouraging. That's not a good sore in my opinion. But when you're like, you're in the gym, and let's say, you're in there 6-8 weeks and you got some good progress, you're in a routine now, and you're moving up in weight, you're getting stronger, those sores are good.
For sure.
Yeah. But you know what I'm talking about? When you don't.
Oh, for sure. Yeah, if you're
Because everyone's
brand
been
new.
there. You take a little time off from the gym, you go in there and like overdo it, and you're like, oh my God, I can't walk. That's a different type of sore.
Yeah, no, when it's that intense and it lasts like a week, you're like, and
you're just tender.
Oh, dude, and I think that's the thing. Like, if somebody's new to getting back into exercise, like, just know sometimes that happens, even if you're trying your best to not, but just like drop the weight a little bit and let that soreness go. It's called delayed onset muscle soreness. It's just your body's going to repair and get stronger, and you just...
The DOMS, right?
Yeah, dude, it's always an experiment. You got to figure out where you're at in terms of the weight you can do and the sets and reps, and that's what's kind of fun about it. Like, just keeping track of things, and it's cool that your body can change and adapt in the way that it can. Like, our system's pretty cool.
Yeah, it really is. So talk about the importance of stretching, because it's something for me that I don't do a whole lot of. Often I go to the gym and I start with lightweight and I just warm up and I go. I don't do much stretching. My mobility is not very good, but it's something that I know I should probably get into. Talk about the importance of stretching.
Yeah, stretching's an interesting one. I would say we have some studies looking at what are the best things for preventing injuries. Strength training scores the highest. Mobility work, stretching, balance training, those all score down lower. And most of the time we'll tell people that, because people often feel bad, kind of like you're saying, like, oh, I don't do enough stretching, I need to be doing more. And really, when you look at most people have the flexibility they need for their daily life. So they don't actually need a lot more flexibility. Like, how often are you like needing to get down into splits in your daily life, or like do a, deep sit and reach and really stretch your hamstrings? So I think there are a lot of benefits to stretching, oftentimes from a mental health standpoint. Like, people like to go to yoga, and I think not only you get the mobility and the stretching, but it also can be a time to kind of just wind down and be present and just have kind of that almost like a mental health kind of exercise. And look, dude, I was a gymnast and a martial artist in high school. All I did was stretch. So I spent a lot of years stretching. I could do 3-way splits. I could do the Van Damme splits across chairs. Like, I used to be really flexible. And so I look back on that, and at the time, the stretching was really important because I was in a sport where I had to head kick people. So I needed flexibility. But nowadays, I don't prioritize stretching like I used to. I really focus on strength training. If there's something that feels tight, like say you are going to go to the gym and deadlift and you feel like your hamstrings are really tight, well then yeah, maybe in your unique situation, implementing some hamstring stretching as part of your warm-up is a good thing to think about. The kind of cool thing about strength training though is if you move through that full range of motion, like we were talking about, like really getting the muscles into a lengthened state, they've actually shown that taking a muscle way into a lengthened position with string training can actually help improve your flexibility.
Give me an example of that.
So like if you have tight hamstrings,
Okay.
you could stretch your hamstrings, but another thing you could do is deadlifts.
Yes.
So stiff knee deadlifts can actually improve your hamstring flexibility.
Mm-hmm.
So
I love the straight leg deadlifts.
yeah.
And my hammies are tight, like because I don't stretch, and so it doesn't. I don't need to go very low for me to feel a really big pull in my hammies.
Yeah, I'm the same way. I've always been, even though I was in all those sports, my hamstrings have always been kind of my tight area, and I'm the same. If I do a straight knee deadlift, I don't have to go super far. If I really try to lock my back out and just hinge from my hips, I'll hit the end of my hamstring, like my hamstrings will tighten up. I don't have to go too far. And I actually, in a lot of ways, feel like I get that helps my flexibility more than if I just sit at home and do like static hamstring stretches.
Okay, so if I'm not stretching a whole ton, as long as I'm lifting heavy weights and I feel good physically, I don't need to worry about it. It's not going to make a difference in how long I live.
No.
Okay.
If you have
That's good.
I think the thing is if you have the mobility, like if you can move your body through full range of motion, you can do all the things in life that you need to do, then you probably don't need to stress about doing a lot of stretching.
Okay. Hey guys, for the first time ever, I'm teaching a group of driven creators how to build a 7-figure brand. When I went all in on my content only 24 months ago, I 4X'd my real estate portfolio, grew my team, and even hosted industry leaders like Grant Cardone on my podcast. Now I'm showing you how to master social media, podcasting, and brand building with proven strategies and a supportive network of business owners. Join a community that's just getting warmed up with 40 plus members and growing. So if you want to learn more to see if we can help you, visit the7figurecreator.com to book a free call with my team. Again, it's the7, spelled like the number 7, figurecreator.com to book a free call with my team. Now back to the show. So another thing I've always thought about and being curious about, everyone's got a cell phone these days. Everyone's got an iPhone. Everyone's texting, whether they're in the car. Not supposed to text while you drive, but I see people texting all the time. You're in the office. Always got you got your head down. You're texting. You got your fingers like this. Your back is kind of pinched up, and your head's down texting. Is that good for you, or is that pretty bad for you long term?
Yeah, it's actually, this one comes up so much. Like people will talk about like tech neck or text neck and kind of rounded shoulder posture, and it's kind of another one of those ones where it's good for engagement on social media, and there are a lot of accounts out there that will kind of use fear mongering to scare people about that. But it's kind of like we were talking about before. Posture, there's not really like bad postures that are going to mess you up. It's more just like you don't want to be stuck like that for a long period of time. But usually, if you get into a position like you're looking down at your phone, your shoulder kind of hunched up, eventually you're probably going to start to feel uncomfortable. And that's your nervous system telling you need to move.
And so you just stop.
You just move out of that position. So like, I will teach people exercises. Like good ones to do are just like pinching your shoulder blades together. Like you just try to think about squeezing. They're called your muscles in between your shoulder blades, like your rhomboids, your scapular retractors. You just squeeze that stuff.
Like a reverse fly.
Yeah, exactly.
Yeah.
Exactly. So like you squeeze those guys. If you tend to have if you notice that you've got your head forward a lot when you sit and like you're working stuff, just think about what you can do is you kind of, it's called cervical retraction, but you basically pull your head back and you kind of tuck your chin. And you're basically just taking your neck out of that position. But so that can help. The key message I think for people is stop thinking about there's good and bad posture. Bad posture is just posture it's any posture that you're in for too long. Even if it's technically what we would have called a good posture, like I said before, you could be in a really good postural position, and that if you hold that for too long, it'll start causing pain in most people.
Yeah, you were saying like in the top of the show, someone could have the best posture textbook wise, but still come in and be like, hey, I got a ton of back pain.
Yeah. I've had people come in that are so focused and just hyper vigilant thinking about their posture, like, oh, my chin's tucked in and my shoulders, I'm standing straight. And some of those people are the ones having more back pain and neck pain because they're so rigid and they aren't letting themselves just kind of flow and move.
Mm-hmm. How much of that do you think is like the mindset getting these injuries? Because you mentioned some of these people that are so concerned about getting a back injury in their posture, then they actually have back problems because of it or neck problems because of it. And same thing goes with getting sick and illnesses, because I know a lot of people that are so worried about getting sick. The second someone has a cold around them, like, oh my God, I don't want to get a cold, get away from me, the germs and this and that. And then they end up getting sick. And those folks that I know personally, I know I think everyone listening to this right now knows some people personally, at least a couple folks that are just always sick and they're always worried about getting sick. And so on the flip side, for me, man, I'm so busy with everything that I'm doing. I get up every single morning. I'm like fucking so excited to start the day. I'm so excited about the future. I'm so excited about the tomorrow and what I'm building. So passionate about it. And I'm so busy with my schedule, right? And I don't have time to even fucking think about getting sick. And people are sick around me all the time. And I'm just like, dude, I don't think about it. Doesn't bother me. And I don't really get sick. So, and I put my body through a lot more than a lot of people that do get sick. And so my question is, how much does the mindset have to do with getting sick or having these illnesses or the back pain and neck pain?
I think it's a huge component. I mean, like I was talking about before, we look at injuries and problems in the body from this biopsychosocial standpoint. So the psycho part is huge, like the psychological side. So there's a huge correlation with mental health problems like anxiety and depression and the development of neck and back pain. So, I think that side, I see lots of patients where their stress levels are more of the problem than anything else in their life. Like it's not about them sitting too long or not, they did this exercise wrong. It's really like their stress levels. And I think, even the like getting sick, when physiologically, when you're really stressed out, it raises your cortisol levels. And when your cortisol levels are elevated for prolonged periods, it harms your immune system. So you're more likely to get sick. So I think it goes, they're kind of different mechanisms, but I think if you're really stressed out all the time, you're more likely to get sick because of what it does to your immune system. If you're really stressed out, you're more likely probably to get painful conditions like back pain and neck pain just because of how those thoughts and emotions factor into, our brain and whether or not we get pain. Like it influences our pain system.
Yeah. Yeah, I was listening to the podcast. This is a little while back, but it was a doctor on, and he was talking about how he did a couple case studies with two controlled groups. And Group A, he had this basically like this milkshake that he was going to give them, and he told Group A, "Hey, there's a healthy milkshake, protein shake, got a lot of nutrients, vitamins. It's going to help you, give you energy and a lot of positive things." And then he gave Group B the same exact shake, and he said, "Hey, this is a bunch of ice cream. It's got 3,000 calories, a lot of sugars. It's not that good for you." And it was the same exact drink. And Group A metabolized this drink really well. Their blood pressure didn't go up. They felt great. Their energy levels were amazing. And then Group B, same shake. They were just told that it wasn't healthy for them. Their blood pressure went way up through the roof. Their body did not metabolize it correct. Their energy levels went down. And he was just like, dude, the only difference was what he told them they were having.
Yeah, it's huge. This is the whole placebo versus nocebo. Like a lot of people know about placebo.
Yes.
Like believing something will help you probably will help you. I mean, there are some studies that say up to 50% of medical interventions are mostly placebo driven. So like if you believe something's going to help you, it's probably going to help you. On the other side is the nocebo. And a lot of people don't know about that. Things can actually harm you if you believe they're going to harm you. So, this is unfortunately used at times by different practitioners. Like this is a lot of why I was frustrated in the beginning and got involved in social media, because I'd have patients come to me who they'd go to some practitioner and that practitioner would use fear-mongering and kind of nocebic messages to scare them, to keep them coming back, which is never the goal in rehab and physical therapy. The goal is to teach people how to self-manage their own problems, like so that they don't have to come back anymore. But the nocebo is huge. We have crazy studies on placebo and nocebo in like even surgery. Like they've done some studies where they have people with meniscus tears, and they literally tell them straight up, you're either going to have a meniscus surgery or you're going to have a fake meniscus surgery. They tell them right at the get-go. But what they do is, if you've ever seen people who've had a meniscus surgery, they do it arthroscopically. They'll put these little portal sites, like little holes kind of in your knee. And so they did that on everyone, but on half of the people, they did the real surgery. On half the people, they just put the little holes, but they didn't do the surgery. They all had similar outcomes. They all got better in terms of pain and function, even though half of them didn't have the surgery, but they believed they did because they saw the little holes. So
that's crazy.
It's pretty crazy. Like the mind is a super powerful thing. I think people don't appreciate how much it plays into your overall health and wellness.
Yeah, no, I believe it. Or just the idea of like, oh, I got some antibiotics, I'm gonna be cured, and then people are cured all of a sudden, Or like, here's another good example. So like, a lot of people, as soon as someone's sick around them, or maybe they got a family member that's sick at home, they think, oh my God, I'm getting sick, right? And then they have that mindset, I'm getting sick, and then all of a sudden they get sick, and then they're sick for a few days, and the second they start to feel better, they're like, oh, I'm recovering, then all of a sudden they recover, And it's like the second you feel like you're going to improve, you improve. And so I always think about like how much the mindset plays a role in that.
Dude, you got to
And
be
it's
careful.
huge, right?
Yeah. You got to be careful with it too. Like I have 2 kids. You can pass this stuff to your kids. We sometimes refer to it like your mindset, how you behave around like worrying about getting injured or worried about getting sick, or, if you are somebody who's worried about that and you have kids, that mindset, we call it a thought virus. You see that it's passed to kids. Like kids learn what their parents do, and you'll see kids who freak out about getting a cut, and then you'll see other kids who don't freak out about it. And they've shown in studies that parents who freak out about their kids getting injured, those kids go on to be more sensitive to pain later. So you don't want to overreact. Like if your kid gets injured, you want to assess it and kind of look at it, is it serious or not? But you really have to try not to overreact, because if you do, you're setting that kid up for failure. You're going to teach them to overreact and potentially make their pain system more sensitive.
Yeah, I mean, it makes sense. I mean, a children's behavior is a function of their parents. And, if you're a hypochondriac, your kid's going to be hypochondriac. But, think about it. Like I said, everyone knows a couple people in their lives that are hypochondriacs, and those hypochondriacs always are in the hospital. They're always in the doctor's office. They're always sick. There's always something going on. The germaphobes, oh my gosh, I don't want to touch this. I don't want to touch that. This person has a cold. Stay away from me. Getting on an airplane, they got masks on. It's like, those are the people that are always sick. It's like you hang out in the hospitals, you're going to be sick. And for me and a lot of these people with the growth mindset, forward thinking, busy, building our dreams, life is short enough as it is, right? I always say months is the best way to measure how much time we have left. And so if average life expectancy for a man is 77, I'm 39, so I have about 456 months left. And so life is already short enough as it is. Why do I want to spend the limited time that I have on this planet worrying about getting sick or worrying about being in the hospital? Like, I'm more concerned with what I'm building. And by me doing so, as a second byproduct, I never get sick. Knock on wood.
Dude, I see that stuff all the time, and I'm the same way as you. I'm always forward looking. I really get excited about progress and growth, and I think because of that, I don't spend a lot of time worrying about these things that might happen. I just keep going. And I think you see that in people who are kind of progress oriented. I think who are kind of those achievers or those striver type people. They just keep doing it. They just keep doing it. Like they don't worry. Like if I'm sick or I've got a cold or this person's around me, they don't stress about that stuff. They're just on a mission and they keep doing what they're doing. And I think because of that nature of who they are and that kind of just hustle and positive mindset, you see them, they seem to be affected by these things less.
No, you're exactly right. For me, it took me 36 years to realize this, but happiness stems from growth and progress. So the second I stop growing, the second I stop progressing, the second I'm not happy anymore. And so that's never going to stop. I'm addicted to growth. And I'm like, okay, what's next? What's the next level, right? Right now I'm going through a phase, another stretch run. I'm going to do 75, maybe 100 days sober and really dial myself, really reinvent myself and move the needle. But because of like all this growth and everything that I'm doing, just like you alluded to, I don't have any time to think about getting sick. And guess what? I put myself through a lot more stuff than a lot of people. My body and all that, I'm like always going, grinding, working out, all this stuff. And because I don't think about it, I don't get sick.
Exactly.
Yeah. But interesting, man. Question for you. So we're on the topic of like text neck and all that sort of thing. What about the folks that are court reporters, they're masseuses, they're always doing something on their hands, manual labor, always working with their hands? Talk about the long-term effects, carpal tunnel syndrome, if I said it correctly. Talk about the long-term effects and what that can do to you.
Yeah, those ones are tricky. Some of those professions those people are more prone to things like carpal tunnel syndrome. I mean, that is carpal tunnel syndrome, for people who don't know about it, is a condition that affects one of the nerves that goes through your wrist. So you have all these nerves that start in your neck and they come down your arm. One of them is called the median nerve. It's the biggest one in the arm, and it goes right through the front of the wrist through this little area called the carpal tunnel. And then it gives sensation to your thumb, your index finger, your middle finger, and part of your ring finger. So on that kind of that palm side. If you're involved in things where you have like repetitive writing, typing, kind of like, like a massage therapist where they're kind of using their wrists and hands a lot, you are more likely to irritate that median nerve because it goes through this tiny little space. And so sometimes people can get kind of inflammation. They can restrict blood flow to the median nerve. And so those professions can get, this is where sometimes physical therapy is tricky, because sometimes people have jobs that are exacerbating their condition, but you can't tell them to, like in an ideal world, you'd say quit that job and switch, but some people just can't do that. So you're often looking for modifications or giving people maybe exercises that help improve, like somebody with carpal tunnel syndrome, you might give them desk modifications, like you might change their computer setup, or you give them a pad like underneath their keyboard, or there are actually nerve exercises. A lot of people don't know this. They're called nerve mobilizations. So these nerve exercises have been shown to improve the blood flow to your nerves. All of your nerves have their own little microcirculation. So you can actually improve the blood flow to your different nerves with these exercises. And so we'll give those to people. But yeah, those people are a little more prone in most cases to developing, like if you use your hands a lot, you're probably a little more prone to developing something like carpal tunnel syndrome.
Yeah, absolutely. I mean, it's a tough position to be in. My sister was a court reporter for many years, and it's tough. Almost every court reporter after X amount of years will get carpal tunnel syndrome, and if you're a masseuse, I think that's even harder on your hands. And so it's a tough. I mean, your shelf life is almost like an NFL player, right? These NFL running backs and some of these NFL stars. It's like, especially for the running backs in the league, their shelf life might be 3 years, 5 years.
Yeah, a lot of those people, like, I sometimes think of them like people who are in jobs where they do really repetitive tasks are sort of like the in-season athlete. Like, in-season athletes are hard to treat because you can't tell them to take a break because they're in season. Like, they've got to keep playing. So you're trying to rehab around that and kind of figure things out as much you can, like trying to figure out ways to reduce their pain and keep them going.
But at least with the NFL, there's an off season.
They get an off season. Like
Yeah.
your sister, the court reporter, she never gets any
There's
time
no
off.
off season.
There's no off season.
Yeah, your masseuse, like, there's no stop to it. The off season might be like your weekend, right? And then you're back to it on Monday morning.
I was just talking to a tennis pro yesterday. He does tennis lessons all day. That's all he does. And he's hitting with everyone. Like, he needs to kind of hit with people. And he has tennis elbow and golfer's elbow. He has a meniscus tear in one knee. He really is not in a situation where it's easy for him to rest those conditions because he needs to use his body like that for his job. So, he's kind of another one like that where he's kind of like an in-season athlete, and it can be challenging to help those people fully get better sometimes.
What is golfer's, what do you call it? Golfer's what?
Golfer's elbow.
What is golfer's elbow?
Yeah, so golfer's elbow is pain on the inside of your elbow. It's basically a tendon condition, like if you think about like tendonitis. So the muscles that you use for gripping things, those are called your finger flexors. And then if you bend your wrist, like curl your wrist in, those are your wrist flexors. Those muscles all attach on the inside of your elbow. And so people who do a lot of, like it happens in golf on the backswing, it challenges those muscles. People who do a lot of like gripping activities. Sometimes people even notice it in the gym. Like if some people have golfer's elbow, it will hurt them to do pull-ups or to do like heavy rows, things where they have to grip hard. So it's kind of like a tendonitis. Tennis elbow is the other muscles on the other side of the forearm on the outside of the elbow. So they're both like a tendonitis, but different sides of the elbow.
I used to play baseball when I was a kid, and I used to pitch. And, I remember in Little League at like, even at 9, 10 years old, I would feel pain after pitching, a whole game. I'd feel it right here. And we would ice my elbow, ice my arm, and then I'd be ready to go in a couple of days. But I'm like, fuck, I see these fucking MLB players. I got season tickets to the Padres, and they're out there freaking throwing, 96-mile-an-hour fastballs over and over. And some of these starters are going, 6, 7, 8 innings. I'm like, fuck, that's crazy. They've been pitching their whole lives. I'm like, I don't know how the fuck they do it, because I would feel tremendous pain at 9, 10, 11, 12 years old just pitching, in Little League. So is that one of the most like brutal fucking arm motions for any athlete?
Yeah, that position, like major league pitchers, javelin throwers in the Olympics.
What's that?
Like, javelin, like the long spike.
Yeah.
It has a similar movement, has a similar stress on the elbow. And a lot of those athletes end up tearing their ulnar collateral ligament, which is the ligament on the inside of your elbow. Like you might hear the Tommy John surgery. Tommy John is when they repair that. And with baseball pitchers, now you'll hear like with younger like kids in middle school and high school, they have limits on their pitching volume. Like they can only throw a certain number of pitches in a given time frame so that they have time for that ligament to recover. Because if you throw too much, the ligament just tears. So, dude, baseball pitchers are kind of crazy too. If they start at a young age, their upper arm bone, your humerus, it actually twists. So like if you look at their arm bone versus the normal person will have this kind of straight looking bone. Baseball pitchers, when they start at a young age, because of the stress over the years, their actual bone twists and adapts. So they have like a torsion in their bone. So, and that allows them to rotate their arm. If you look at baseball pitchers, they can rotate their shoulder way back into external rotation, almost twice as far as the average person. And that's because part of that is because of that, their bone has twisted, which ends up helping their performance. It allows them to throw the ball faster. They can cock the ball back farther and then really throw it faster. But so they get all these kind of crazy adaptations. I mean, again, it's like where the musculoskeletal system's so cool. If you start things and gradually expose your system to it, it will adapt over time.
Yeah, it's interesting. I've always like admired, because I played sports as when I was younger, even skateboarding. I've always admired these older athletes that can just play it for decades and decades at a high level. Because I know as a kid, even I was like, man, it's fucking the aches and the pains. It's a lot.
Yep.
You know,
Yeah, I think there's a lot. Some of those people are probably just genetically gifted, but I think there's a lot of them who
it's a
actually
lot of it's
like,
genetics, right?
for sure,
Yeah.
genetics, like for sure. I mean, but I think there are some of them out there like LeBron and some of these people who really do take their health seriously, and all of the science around this is getting so much better. So I think, people are a lot smarter now about their structuring, how they structure their training programs, how much rest time they have. Because, before athletes never had rest time. And that's been a huge part. Like, think about how much people talk about recovery now. Like recovery and rest. There's all these different tools like massage guns. There's everything for recovery. And so I think people are finally doing a better job of like being intentional about their recovery process.
Yeah, that makes sense. I'm going to actually be getting my blood work done next week. Never done it in my life. I'm going to get my T levels tested. I'm going to get a bunch of stuff tested. I'm going to see like what I'm allergic to, what I'm not, like basically everything. And I'm excited for it. But, a lot of people have been telling me, hey, man, all the podcast guests that come on that are like 35 and older that look good, they're all on the testosterone. And they're all telling me like, hey, man, fucking game changer. Like, what are you waiting for? And so I'm going to see what my T levels are. And I just had a testosterone doctor on a couple weeks back talking all about it. And so he's actually going to be doing this with me. So I'm going to see. I haven't made my mind up yet and committed yet. Part of me is like, why not do it now when I'm young? I still have my health. I can actually enjoy the benefits of it. And I think there's going to be a lot of benefits outside of just muscle growth, but it's like the energy levels. I think a lot of that's going to translate over to business, right? More confidence, all that sort of thing. But on the flip side, I'm like a little bit hesitant because I'm like, I don't know if I'm going to be poking myself in the ass twice a week for the rest of my life.
Yeah, you're stuck on it, right?
It's a lifelong commitment.
Yep.
Because your body's going to now produce less natural testosterone once you start injecting. So it's like give or take. I'm like, okay. So anyways, I'm going to get my T levels tested. That's probably going to give me the answer that I need. And we'll go from there. But what are your thoughts on blood work, T levels, all that sort of stuff?
Oh, blood work's huge. If you aren't measuring it, you don't know what's happening.
Yeah.
So there's so much going on, so much you can understand with blood work. I do my blood work on a regular basis, and when I first started it actually was related to energy levels, and I wanted to see where my testosterone was at. Luckily, mine was still like around 600 or something, so it was still in a good spot. But I found some other things, like I have a genetic history. I don't know if you've listened much to Peter Attia, but he's a physician, big podcast, and he talks a lot about different cardiovascular health markers and these 4 horsemen, the 4 things that kill most of us. But when you look at cardiovascular disease, there's actually these things now. Back in the day, people used to worry about cholesterol, and now they've kind of debunked that. But there are these things in your blood that you can only find with these specialized lab tests called ApoB and ApoA, and they're sort of like the carriers of cholesterol. And now they're finding that ApoA and ApoB are the things that are associated with the development of cardiovascular disease, so forming plaques in your heart. And so that was the biggest thing I found, is that I'm in 20% of the population have genetically elevated ApoA and ApoB, and I'm one of those people. So I have an increased risk of developing cardiovascular disease, which I would have never known because I exercise all the time. I take care of myself. I have a family history for it, which was made me think about it, but I would have never known without having that blood work done. So I actually just like a month ago started on a statin. Like a statin is a cholesterol lowering medication, but it can help lower these ApoA and ApoB things. So I think I would have never known that without the blood work. And I found some other things, like my vitamin D was a little low, my magnesium. So, I've got some other supplements like that going, but dude, I think everybody should probably be doing blood work twice a year.
Yeah, I'm excited for it. At what age should they start doing it?
I would say, I'm 42. I started probably like around 40, kind of like similar age to you. I think to me, a lot of these diseases pick up past the age. Like if you look at cancers and different I think if you start, a lot of this stuff people won't talk about till 50, but I think if you start at 40, you can really stop these things before they come too severe. Like I went and had a CT scan done on my heart. It's called a calcium score. And it looks for calcium deposits in your heart, like early signs of cardiovascular disease. They found this like tiny little bit of development, which if I had waited till 50 to do that, I might not have caught it early enough, but because I'm 42 and now I'm taking the statin, it's going to stop that from getting worse.
I see what
So
you're saying.
I think start at 40.
Start at 40. Okay. So CT scan, that's something else I should be starting at 40.
Well, blood work.
Blood work.
I think
the
start
blood work will
work.
catch that.
But if you have a cardiovascular disease history, there's all these cool screening things that you can do now. Like there's full body MRI. A lot of people don't even know this. Like you have to pay cash for it. Usually insurance won't cover it, but you can do a full body MRI and look for cancer. You know, most cancers, like cancer screening really kind of starts around age 50. But dude, I think when you get close to 40, start doing some of these screenings. I've had a few friends die from stuff like super early cancers, heart attacks. Like with screening the way it is now these days, you can stop so many of these things if you catch them early.
Talk about the effects of like alcohol and that sort of thing on the brain, but also just your overall performance and longevity.
Yeah, I mean, alcohol is a toxin, right? It's a toxic substance for your body. So I basically stopped drinking. I was kind of just a social drinker.
2 to 3 times a week, couple glasses of wine.
Exactly. Like that kind of thing. Like I've gotten to the point now where I just don't think it's worth it anymore. It destroys my sleep. So I end up not sleeping as well. There's so much research on the negative impact on your sleep. Alcohol, in terms of my specialty, like thinking about people who have musculoskeletal injuries, alcohol impairs soft tissue healing.
What's that?
So like if you tear a muscle, tear a tendon, tear a ligament, it will heal more slowly if you consume alcohol regularly. Same with smoking. Smoking delays the healing of injuries. So, you know, not to mention all the effects on your liver. You know, Alzheimer's is linked now to alcohol intake. Like,
really?
Yeah. There's like 6 different behavioral modifications you can take to limit your chances of developing Alzheimer's and dementia. One of them is no alcohol. You know, exercise is a big one. Like,
I believe it because for me, when I'm going through a phase where I'm not drinking, like I did 76 days in the spring, kind of leading up to the summer. I drank July and August, and now I just started a new season where I'm gonna do another 75 to 100 days. And I'm only like, I think today's day 15. And I noticed a huge difference. Oh my gosh, my energy levels are freaking through the roof. My capacity, my brain capacity to like recall and remember certain things is like way better. My ability to speak, talk, everything just becomes better. My fitness is more dialed. I'm in the gym every single day. I'm getting my steps in at night. My body is getting more fit. I feel more confident. I'm a better version of myself. And that's the number one thing that I noticed is like your confidence level goes through the roof. Productivity goes to the roof. Like I'll finish one task. I'm like, okay, what else can I do? You know, how else can I reinvent myself? I'm like, testosterone. Okay. Is that going to give me a competitive advantage? Let's do it. What else can I do? Right. And if I think about the last 75 or the 76 day run I did, I couldn't think of one negative during those 76 days. My business was like this. My fitness was like this. I secured a Built sponsorship during that time. I bought a boat during that time. I like made some pivots within the business that grew them. And then July, August, I drank. And oh my God, after doing 76 days for the first time in my life, I was like, I noticed my energy levels were way down. And a lot of people say, oh, you're maintaining. And it's like, no, there's no such thing as maintaining. Everything was slowly like this. Business, my fitness. I was working out 2 or 3 times a week. My workouts were 60% of what they were. Literally like just everything started just slowly slipping, right? And I did 2 months, and then I'm like, dude, I'm fucking back on the wagon. And now I'm back on it. It's been 15 days, and I'm like, I'm back. Everything's clearing up. All the problems are going away. 99.9% of our daily problems, I believe, are solved by cutting out alcohol and waking up at 5:30 in the morning.
Yeah. The alcohol part is huge. People need to do what you just did and take some time off. Like just do a month of no alcohol and you will see the difference. I mean, alcohol, literally, there's so much research on how bad it is for your sleep. Sleep is when your body heals. It's when your brain cleans itself. Like if you are interfering with your sleep, you are not going to recover. Think about working out. Alcohol interferes with protein synthesis. So you will not gain muscle mass and strength the same way you would as if you weren't drinking. So it is such a huge component to me. Like it's almost the first thing. If somebody's coming in and they're drinking regularly, it's like the first thing from any health factor that you need to, I think people just need to think about that and at least take a month off and see how much better you feel. It's hard to do because it's fun. You go out, like, dude, there's all the times I'm out and I'm like, freaking beer would sound good or so good right now, or a cocktail or something like, but I know there's been enough times where I do that. And then the next day I feel, it's like a 25% reduction in my capacity, maybe more, 50%. Like it's not worth it anymore.
Dude, for me, I was drinking socially like 2 to 3 times a week. And, too often, 1 or 2 glasses would turn into a late night. But that's 2 to 3 times per week where I'm operating at like 50% capacity the next day. And so it's the day that you're drinking, and then it's the entire next day that you're recovering. And so if you're drinking 2 to 3 times a week, that's 4 to 6 days out of the entire 7-day week to where you're not focused, you're not operating at 100%. And that compounded over weeks, over months, over years is the difference between someone playing college golf and making it to the freaking PGA and becoming Tiger Woods, Rory McIlroy. And I'm just like, dude, I realized like, I'm 39 years old right now, and I realize there's levels to the game, and there's only so many levels that I'm going to get to. There's a certain level that I'm going to get to where I'm going to kind of peak out. It's a ceiling under the circumstance of going out and drinking and kind of being in the scene and that sort of thing, which is fun to enjoy. Don't get me wrong. But if you're going to continue that year round, where you're drinking and that sort of thing, there's a ceiling to where you're never going to break through. And I look at my competition because there's levels of the game, and the people that are ahead of me and the people that are 2 levels ahead of me, a lot of those folks don't even drink, or they take massive breaks multiple times throughout the year and only drink a little bit here and there. And so for me, I'm like, you know what? I'm going to pick my seasons, right? Because I think it's good to enjoy every now and then. And so for me, I really like this 75 to 100 day stretch run where I dial it, I reinvent myself, and then, you know what? Cool, enjoy it for a month, maybe 2, and then back into it. And, for me, I did July, August. I was back here in San Diego, July and August. The weather's great. There's a lot of concerts, there's a lot of activities, a lot of parties. It's great to be outside on the boat. And so it's a good social, couple months to enjoy it. But I'm thinking like the rest of the year, I'm like, I don't know if there's any other like month or 2 window where I'm like, oh my God, I really need to fucking have a drink, because the opportunity cost of me doing that is fucking massive. And as I grow, the woman in the red dress gets hotter at every level, and the opportunity cost of me drinking increases at every single level. Does that make sense?
For sure. Yeah, I agree with you. It's like you don't want to sit and stress out about like, oh, I can never have a drink and feel like you're limiting yourself. I don't like to
tell myself no.
No, you don't. You just try to have that balance. And I think most of the time, I know so many successful people that just they drank at one point, they don't drink anymore. And I think you kind of think of your career almost as being a professional athlete. Like I've heard of like entrepreneurs talk about this. Like if you're going to take it to those next levels like you're talking about, the alcohol is going to stop you from getting there. If you're drinking regularly, like if you're doing it once in a while for fun, you got a little, it's like, of course you're on vacation. Like there's going to be times where you have some drinks, but I think the majority of the time, if you're thinking about taking your career to the next level, whether you're a athlete and you use your body physically, or you're somebody who's like career oriented and you're using your brain, you're kind of a professional athlete in either of those. And if you want to take it to the top level and achieve the most you can, the alcohol is only going to limit you.
It's so true, man. And like, I think about this all the time. It's like you have, as an entrepreneur, business owner, real estate investor, at a certain point, you have to start approaching your business like you're a professional athlete. You have coaches for every single little thing, right? Like LeBron James has all these fitness coaches, strength trainers, mindset coach, all this stuff. Same thing as an entrepreneur. In order to get to that next level, like I got a business coach, okay? Bring on a mindset coach. We're in all these different masterminds. I'm bringing on guys that are going to help me scale to YouTube, right? All these things you have to start approaching like a fucking professional athlete. Otherwise, you're going to be capped. You're going to hit a ceiling, and you're never going to push through to that ultimate thing. So I agree with you. And it makes you realize there's levels of the game. And at each level, there's another fucking level. In order to break through, you got to sacrifice certain things. And it's not forever, but, for certain seasons, you got to sacrifice certain things. And if there's no sacrifice, there's not going to be growth.
Mm-hmm. Yeah. I agree so much. You have one life to live, so why not go for it? Go for it maximally. Do everything you can. And if you've got things that are obviously limiting you, why keep those around? I mean, I think it's like negative people. Same like alcohol. You were talking before about the 5 people that surround you. I think having negative people, it's almost like the alcohol in a way. Like that stuff brings you down and influences how much you can grow. And so I think you just have to, wherever you're at in life, like you've got one life to live, and if you want to make the most of it, you have to, too many people are just on autopilot, just doing each day. And I think you have to think about, where do I want to get to, and then reverse engineer that and go back. And if I'm going to get to that point, this ultimate goal that I have, what do I need to do now to get there? Because I think so much of us as humans, we find meaning in progress. And so, you run into lots of people who have no progress in their lives and they're depressed, and so I think if you're in that state, you've got to figure out like, where do I want to go? How can I start chipping away at this in baby steps and start making progress and get rid of the things that are hindering me?
That's so good, dude. And I love what you said. It's like you're some of the 5 people that you spend the most time with. So when I hear people saying, oh, I'm not making the kind of money you want to be making, I'm not getting the deal flow, I'm not buying the kind of deals I want to be buying, the answer is look at your 5 closest friends and the 5 people that you surround yourself with and spend the most time with, and write down all their income, and then add those 5 incomes up and divide it by 5, and that's going to be your ceiling, right? And so those 5 people are out there drinking, partying, and that's the kind of money they're making, and you're like wondering why you're not making more money, and you got all these problems and you don't have answers to your problems. Look at your 5 friends, and that's often going to give you the answer that you're looking for.
Dude, we are all trapped in our little box of how we view the world. And you don't think outside that until you meet people who do things that are different than what you're doing. And I know this for sure. I grew up in Montana. Like, people don't have, I grew up around a lot of middle income type families. Like, and that's fine. They're all like, everybody's nurses and, lawyers and different, just kind of regular professions. And that's great. But it wasn't until I came to California and met a lot more entrepreneurs that I saw the potential. Like, once you meet people who are doing big things, you start to realize this is actually possible. And then it's not until you really feel like something's possible that you start to think, if they can do it, I can do this. And so you have to, surrounding yourself by those people, around those types of people, allows you to get to level up, to keep leveling up.
Dude, it's so true, man. It's all about getting in the right rooms. I always say, get in rooms where your dreams are others' realities. That's the quickest way to improve your life. And dude, it makes sense, man, because you hang out with 5 people that have limiting beliefs around a certain goal that you're trying to accomplish. It's going to make it near darn impossible for you to accomplish that goal or that thing that you want to do. But then again, then you get into a room with 20 people that are like, oh, we've done this a million times, and they're like, they might tell you your goal is thinking too small, and you're like, oh my gosh, it was too small. And it's just like a way to really shortcut that path from point A to point B. Or maybe you jump cut point B and you end up at point C or D, right? And so I always say getting the right rooms is everything. And, who you surround yourself with, it really is a function of where you go in life.
Mm-hmm. Yep. Yeah, I couldn't agree more. It's so true. I've really learned it this last year. Getting to come here and meet someone like you, like, I love these opportunities because I'm meeting someone new everyone who runs podcasts like this, who's got YouTube channels, they're all people who are like, they're strivers and achievers, and they're like going after it. They're not people just sitting back. Like, they literally are thinking about, like, I've got this one life and I'm going to go after it and do everything I can to make moves. And those are the people, it's inspiring. Like, I love coming to places like getting to meet you today. It's amazing.
Yeah, so good. Question for you. You mentioned YouTube and Instagram. You grew a massive audience in a relatively short amount of time. What was the 1 or 2 keys to all that growth?
Provide value to people and do it consistently. Like, you just have to. That's what it's all about. Like, keep going. You have to keep going. All of these platforms, anything in life is a marathon. Like, I think anything in life at this, the older I've gotten, and I think seeing, the growth on these platforms, but then just extrapolating that out to everything else in life, as I reflect back on it, I realize, and you hear people say this all the time, but it's so true. You just have to keep showing up. Like, help people, solve problems, provide value to people, and just keep showing up. That might mean you're an entertainer. It might mean you create inspirational content. It might mean you're an educator. Like, whatever it is, just keep showing up in that way. And if you keep doing that, you will grow and become more successful, and other people will drop out. So I think you've got to find the formula that allows you to provide value and keep showing up. If you bite off more than you can chew, because you see a lot of people do that, they bite off more than they can chew, and then they can't maintain that pace. So you've got to find the pace, I think, that works for you. And this was a slow evolution for me. I didn't get into all this thinking it would be a business. Like, it was just a hobby. So I've evolved slowly over time to realize what my capacity is, what can I show up and do every day. And if I keep with that formula, everything grows.
That's so good, dude. Yeah, I agree with you, man. It's like I see a lot of people come and go, competitors, people that are getting in the content game. They'll start it, they'll ramp it up for a month, and then they'll realize, oh, it's not as easy as I thought, right? And it's not exciting anymore. And then you see people drop off, they give up. But it's like that's where the growth is when you can get through that month 1 to month 12, and you can do something, especially with the content, consistently enough to where you can do it for 12 months. And at the end of 12 months, 1 of 2 things is going to happen. Either you're going to pop off, or you're going to learn a lot of what to do and what not to do, and you're going to pop off in year 2 if you stay consistent with it. And that's where it's at.
I think that's actually a good time frame you just mentioned, because I've thought about this a lot over the years. Like, if you're going to go into any of this, content creation is such a huge industry right now, and I don't think it's going anywhere. Like, if you want
4.8 billion people are on social media, And you know how many are creators out of the 4.8 billion? 1%.
Yeah.
That means 99% are consuming, 1% are creating. And so think about that. 4.8 billion, and that number is going to be 10 billion at some point.
Yep. I think give yourself a year. Like figure out how can I, whatever platform I'm on, if it's on YouTube, I'm going to show up 1 to 2 times a week. If it's Instagram, TikTok, I'm going to try to show up every day. Like, but figure out what is that formula? What's that pace you can do that allows you to do that for a year? And at the end of the year, like you said, you're either going to be blowing up or you're not, and you're going to learn a lot, and then you're going to change your strategy. But you already have a formula to keep going. So I think people have to go into it with the marathon mindset. This isn't a month game. It's not a 6-month game. It's a give yourself at least a year. I mean, I started a podcast in April. It's a lot of work, but the crazy stat is 90% of podcasters don't get to their 4th episode. I'm on episode 25 right now. So I just know, dude, I'm going for a year. At a year, I'll probably just keep going. Like, that's just my nature. But, you know, there have definitely been times that I'm like, fuck this. I don't want to do this podcast anymore. But I know from everything else, I've just got to keep showing up. And if I do, I'll break through. And if I don't, I'll learn what to tweak and I'll ultimately break through.
That's so good. I love it, man. Dude, I appreciate you coming down, man. Santa Barbara, love and enjoyed this conversation. Talking shop, you're a good dude. I'm a fan of everything you're doing, and maybe we'll run it back here in a year or two. And if I'm ever in Santa Barbara, dude, I'll let you know. We're always looking at hotel deals up and along the coast. And if you're ever back here in San Diego, let me know, dude. We'd love to connect again.
Heck yeah, brother. This is awesome. Thanks for having me on.
Where can the folks get in touch with you?
I'm at Rehab Science on Instagram and YouTube. All the rehab content. My book, Rehab Science. How to Overcome Pain and Heal from Injuries on Amazon, Barnes & Noble, all major bookstores. So yeah, feel free to DM me if people have questions.
And what about your podcast?
Oh, podcast is Rehab Science, all the major podcast platforms. So yeah, Apple, Spotify, look for it there.
I love it. There it is. He's Dr. Tom Walters. I'm Rich Summers. Listeners, thanks for tuning in. We'll see you in the next one. Peace.